psychoeducation from different people. Actually, all of you are professionals working in the field, so we don't need to actually test your capacity, definitely. So this is actually one platform where we can present our knowledge and skills with others. That is the main thing. So don't be in any sort of a um, this is not a competition, first of all. Okay, don't worry about that. So we are sharing our knowledge on various
Present.
topics. We
Yeah,
are
yeah.
not talking to us um, thinking that we are patients. Okay, so you are taking classes for the patients. So from that climate, that mood, you can do your presentations. And psychoeducation is a very integral part of our client management. Not only individual counseling, not only group therapy, psychoeducation is also as important as any other thing. Like, education is very important for people to know what addiction is, the disease concept of addiction, how it affects their relationship, their family, their environment, their work place. All these are very important, actually, when we deal with addiction as a whole. When we treat addiction, we have to keep all this in mind. Co-occurring disorders. I'm sure, I'm happy that all of you have come out with different topics related to client management. So we will get an overall picture today about various topics in one platform from different resource persons. So take it as a very positive opportunity for each of us to learn from each other, and then also not to cheer, like not make it a light program. Don't have to be in any sort of a stiff mood. Make it engaging, like no participant engaging, crack jokes sometimes, so that we will all laugh in between. So we would be keeping a few things in mind. Of course, the clarity of what you are presenting, like the theme clarity, and of course the content of the presentation, and then the PowerPoint. If you are presenting any PowerPoint, the clarity and quality of the PowerPoint, and also at the same time your presentation skills, your participant engagement, and things like that. So these are some of the things. We are not kept anything in order and giving you any evaluation. Just go ahead with your presentation. Over to Ronnie. Ronnie will be conducting the whole program today. So he will give you a ground rules about how we will be doing this program. Keep up the timing, okay? Because this is not something which we have to, actually 2 hours needed for your topics. We know addiction as a disease, even 2 hours also not enough. But this is not to cover entire, like 7 minutes, you should be able to communicate what you want to communicate. Accordingly, you plan up things, okay? So a little bit of grace time we may be able to offer, half a minute or something. Ronnie will tell you about that. Okay, so over to you, Ronnie. Please take over.
Yes. Okay, good evening, everyone. I'm happy and glad so many people here, 34 members. Okay, this is a very important day, I can say. We have this presentation session that we have planned here, and I'm happy that many people, without a second thought, have come up uh, straight, and they wanted to show what they want, their skills and their expertise through this presentation. And we have a large number of audience as well. And the participant, please don't be nervous because of this. I'm pretty sure all the participants here is wishing you a really best of luck as well. And to I want to start with a small, not rules as such, but something all the participants need to notice and follow through. This basically your speech must be limited to less than 7 minutes, because we would like to give all the participants ample a chance for them to speak. To help you better with it, I will be sharing 3 colors to show you how much time you have taken. At minute 5, I'll be changing my background to the green color, and at minute 6, I'll be changing it to yellow color, and at minute 7, I'll be changing it to red color. So this is not to make you feel nervous or anything. It's just to help you out with your timing. Apart from that, many people who wants to share their PPT, it is very easy. If you are not familiar with Zoom, you just have to find the share screen button. It's in the bottom middle, and you just have to click on it and select a PPT. Please keep in mind that your PPT should be in the background itself, so that you can easily access it. Other than that, in the end, we are also, again, as Dr. Thomas have said, this is not a competition, but to keep it fun, we have a small voting session in the end where you can select what you think is the best speaker. That will come in the end. That's all for the things that you need to note. We can start the presentation now. I hope everyone is having a fresh mind and all ready right now. We will start with Richa. Richa, are you free? Are you ready?
Yes.
Okay, will you be sharing your PPT here?
Yeah, should I do a share screen?
Sure, okay. I will start the timer once you start the presentation, okay?
Okay. Can everyone see my slides now?
Yes.
Okay. Great. Okay. Hi. So I'm Richa, and I work with ARCO, which is Addiction Recovery Coach, and it's an online platform that helps to treat people suffering from substance use disorders. And today I thought I could talk about addiction so that we can understand it a little bit better. So when people think about addiction, they think about it in vastly different ways. You can ask a number of people what it is, and you'll probably get like a number of answers. Some of these answers have shortcomings, and some of these answers can be extremely problematic. It is important to discuss varying conceptualizations of addiction because beliefs and attitudes form action. In other words, your understanding of addiction can impact how you treat those with addiction. So let's take a moment and see which of the following statements you believe to be true. Addiction is solely a matter of choice. It is solely physiological dependence. Or is it solely a brain? Now, I know the word solely kind of gave it away, but a few months ago, I wouldn't have known the answer. If none of these felt accurate to you, then you are right. These are all myths about addiction that we at ARCO are hoping to debunk. Myth number 1, it's solely a matter of choice. Yes, some level of personal choice is of course involved, but many practitioners put too much burden on the individual and forget to consider how the role of social conditions and policy lead to maladaptive substance use. We know that, in fact, social status and context plays a significant role in addiction. Hinging addiction solely on personal choice is indicative of the moral model which dominates how many people view addiction. This model asserts that substance use is a failing and resulting from moral weakness, bad choices, or deficits in the individual's self. This is why you often hear addiction likened to being dirty, while sobriety is often referred to as clean. The moralistic approach can create barriers to treatment. As a person with addiction fears negative consequences, such as going to jail, losing their job, or alienating loved ones. Now let's see what happens if we approach a patient from the moral model. Now this might sound like a provider saying, you know, it's pretty obvious, Mr. Sharma. That's what is going on here is that you're an addict and you need help. Take a moment and put yourself in Mr. Sharma's shoes. How would you like to hear that? And how would that make you feel? Is that encouraging? Is that helpful? The practitioners at Yale University surveyed their patients, asking them what were their first thoughts when they heard the word addiction or addict. Sorry, I'm not able to, yeah. The common responses they got was the patients felt bad, they felt judged. The words that came to their mind was junkie, loser, dirty. None of this is helpful. The moral model makes people with substance use issues feel worse about themselves, and it compounds the problem. Now let's look at addiction is solely a physiological dependence. This model seeks to take the burden of choice completely and highlights the body's natural reward mechanism. So while it may be true that continued use leads to dependence, even despite harmful effects, that is not the whole story, right? If addiction was just a matter of dependence, then once the person has detoxed, they'd be free from addiction. But that's actually not the case. Let's see how this manifests clinically. Suppose a provider recommends detox as a treatment, and he says, Mr. Sharma, because of your substance use, you have developed a high tolerance and can go into withdrawal. What you need to do is find a detox facility and quit cold turkey. Now, this approach puts the burden on the patient, ignores the personal goals, and removes the provider from the equation, which again, not helpful and not a long-term solution. Detox is not a form of treatment for substance use disorders. In some cases, withdrawal is not necessary at all. In other cases, it's just one step, most of the time, very first step in a complex, comprehensive treatment plan. Myth number 3, addiction is solely a brain disease. Now, this is similar to the substance dependence view of addiction, as it focuses solely on the biology of the brain. The downside is that it neglects the environmental and social forces that apply. And the fact that it involves a continuum and that many individuals recover without any sort of treatment. So in the brain disease model, it might sound like this. So Mr. Sharma, it's clear you have an addiction, which basically is a brain disease. We will prescribe some medication that will target the brain to help you manage this addiction. Doesn't sound too bad, right? I mean, it's not the worst thing, but this does not address the work the patient needs to do in order to change their behaviors to get back into a healthy routine. So the entire focus is on medication or pharmacology alone. So as Carl Hart, a professor of neuroscience and psychology at Columbia University, said that the real problem with drug addiction, for example, is the interaction between drug and the individual's brain. Then the solution lies in 2 approaches: either remove the drug from society through policies and law enforcement, or focus solely on the individual's brain as a problem. Then how do we define addiction? So if it's not just a matter of choice, physiological dependence, or a brain disease, while there's truth to all those statements, which is why they have proliferated, they should not be isolated theories, but combined into a comprehensive model. Addiction is a chronic, treatable medical condition that acknowledges the biological, psychological, socioeconomic, and spiritual dimensions of the disease process. Can't you hear me? With this comprehensive model in mind, let's go back and revise some of the statements we heard earlier. In the moral model, we blame Mr. Sharma that he's an addict, which makes him feel bad. But in a chronic disease model, we can say, so Mr. Sharma, what is clear that you're experiencing a substance use disorder and I can offer some help. Substance use disorder here in the chronic model does not define them. Rather, it's something a person has like any other disease or condition. Now let's revisit the physiological dependence model. In this, how we'll treat it differently in a chronic disease model is, Mr. Sharma, depending on your goals, we can explore medically managed withdrawal or review medications that will curb your cravings and withdrawal symptoms. Would that be okay if I discuss these options with you? Here, the sole objective and physiological model is to wean off a substance from the patient and poof, addiction is gone, but that's really unrealistic. What is realistic is factoring in the patient's goals, asking the permission, and matching them with a variety of treatment options. Sorry, I just need 1 more minute. Now, when we look at the brain disease model and we compare how we can talk to the patient from the chronic disease model, we say, based on what you have shared, you meet the criteria for severe substance use disorder. I know that is hard to hear, but remember that addiction is a chronic disease like diabetes, and it is treatable. I have some ideas on what might be helpful. May I go over some treatment options with you? What this does is it compares substance use disorders to diabetes, which helps to refocus us on the treatable nature of substance use disorders. With diabetes, the practitioners emphasizes healthy living and eating, the need for medication and monitoring blood glucose and follow-up. And we can do the same with substance use disorders. The three essential components of treating substance use disorders are healthy behaviors by the patients, pharmacology or medications, and engaging in a therapeutic treatment program. Moving forward, we at ARCO hope you can acknowledge that addiction is a chronic condition with behavioral components, just like diabetes or high blood pressure, and give patients the hope that substance use disorders are treatable, and we are here to help. Thank you.
Thank you, Richa.
Thank you, Richard. That was a very good
Hey.
session.
So sorry about going over. I just saw the red and I froze, but yes, thank you for letting me continue.
Yes.
Okay, let's move on to the second. Is Mary Jennifer here?
Yeah, I'm here.
Okay. Let's. You will be presenting with a slide, right?
Yeah, I'll be doing it orally. Yeah.
You can also engage participants also, okay, if you want.
Sure, sir. Okay,
If you
sir.
want to ask questions, give them time, but everything within 7.5 minutes. Half minutes for your, yeah, okay.
Okay, Mary, you can start now.
Yes, sir. So very good evening. So myself Jennifer here. So my topic for the day will be on addiction and disease. Yeah. So as family members, we may wonder what actually happened to my beloved one. Why is he all the time under the influence? Does he don't want to take up the responsibilities, or is he doing it on voluntary basis, or does he want to escape from the responsibilities? But you know what is the fact? In the year 1952, World Health Organization with American Psychiatric Association, they declare saying that when a person's drinking or alcohol interferes with five important parameters of his life. When I say five important parameters of his life, it can be for every human being. Family relationship is very important. Occupation is very important. And social standing is said to be very important. And finance, again, important parameter. And obviously, our physical and mental well-being is said to be very important. So when my drinking or drug abuse interferes either one or all the parameters of his life, World Health Organization and American Psychiatric Association declared saying that he or she is progressing to a disease category called addiction. Yeah. So now, say for example, I know that only because of my addiction, I'm having a lot many issues in my family. Say for example, my wife doesn't respect me at all. She has applied for the divorce and she wanted to get separated from me. And my children are begging to stop my alcohol or drug. Yeah, so daily there have been disputes in my family. I understand it's all because of my addiction, but still I'm not able to put an end to it. And when I say occupation wise, my boss would have warned me. He would have given me memo, and finally he would have also suspended me, and at least he would have also terminated me from the job. I know it is because of my addiction, but still I'm not able to put an end to it. And when I say social standing, people have respected me. People were ready to get my advices. They were ready to seek my suggestions, and the same people and the same person trying to ignore me. They don't even want me to be part of the family function. I understand it's completely because of my addiction. Yeah. And then finance wise, I am borrowing money for higher interest rate just for the sake of alcohol and drug. I'm pledging my own family's, my wife's jewelry. Yeah. And I spend all my salary only for alcohol and drug. I know it's all because of my addiction. Still, I'm not able to put an end to it. Yeah. And obviously, physically and psychologically, I'm at off. Total deterioration, And so I understand it's all because of my addiction, but why still I'm not able to put an end to it? Why? Because this person, he or she, has started developing a dependence physically as well psychologically. When I say physical dependence, what exactly does it mean? Any idea? Fine. So yeah. So when I say physical dependence, yeah, So I wanted to put an end to my alcohol and drug, but alcohol or drug that easily not letting me to go away. Yeah. So when I stop my alcohol or drug for few days, I start developing a discomfort. In other words, withdrawals. I start developing sleeplessness night. I have severe tremors. I cannot sleep at all. I cannot eat properly. I start developing anger issues. I have irritations, and I don't have history of epilepsy at all. But when I put an end to my alcohol or drug for few days, I start developing epilepsy also. So due to this physical dependence, I go back to my drinking or drug abuse again. And when I say psychological dependence, always preoccupation about my drinking, when to drink, where to drink, what reasons can be made for my drinking, what justification can be given to my drinking. So always, preoccupation and psychologically dependent about my alcohol or drug. Due to this, I start getting back to my alcohol or drug again. Yeah, and then what happens? Addiction is again said to be classified into three different stages. Yeah, primary, progressive, and treatable. So when I say primary, when you ask people, so why do you drink? What happened? What's wrong with you? He will give you plenty of reasons. Ma'am, my wife doesn't respect me at all. My boss doesn't give me respect at all. I have a lot of financial crisis. But the primary issues is only because of his addiction, his wife is not respecting him. Only because of his addiction, he is facing through a lot many issues, occupation wise. So when I put an end to my, when I sort out my addiction issues, automatically other issues will fall in its own place. Yeah, again, yeah, it is progressive disease. Just imagine when a person started drinking initially, he would have started with 30 ml or 90 ml or 180 ml. It can be, or even with one bottle of beer. But now, now at present, when he drinks for 30 ml or 90 ml, 180 ml of ml, our patients used to tell us, ma'am, it's just an ant bite for me. My tolerance level has been increased. So after treatment, when he thinks, okay, let me put an end with only beer, let me drink with only 180 ml of alcohol, definitely addiction is a progressive disease. It will progress and definitely will not reduce your drinking habit. And obviously, yeah, it is treatable. And also, addiction has different stages, like different symptoms. Just like COVID has got its own symptoms and diabetes have its own symptoms. In the meanwhile, our addiction have also got own symptoms. I'm not, going in depth about the symptoms and all due to this time constraint. But let me tell you, disease are classified into three different stages: early phase, middle phase, and chronic phase. Yeah. So early phase has got its different symptoms. Middle phase again it has different symptoms, and chronic again different symptoms. This addiction can be treated at any stages. Yeah. As the addiction counselors and as mental health representatives, it's our responsibilities, it's our duty, to join our hands together to bring our patients or to bring our clients, to out of this habit. So I wish you all the very best.
Thank you. Thank you,
Yeah, I'm
Jennifer.
done. Thank you, sir.
Next.
We have Raman next.
No, wait.
Raman, are you here?
Ronnie, wait. So if
Yeah.
in case anybody have any questions and all, okay, let's have something in between. No worry. We don't need to hurry up. So anybody have any question? One question?
Dr. Thomas,
Because
yeah, I just wanted to say, beautifully done with a lot of energy. I don't have any question, but I'm just appreciating the effort. And
very good. Very
thank you so much, Jennifer.
Thank
Thank
you.
you,
have a
sir. Thank you,
question.
sir.
Yeah, Gary has a question to you, Mary.
Yes, sir.
Mary,
Yes, sir.
Mary,
Gary, it's not clear, Gary.
presentation. Good evening. I just
No,
was a bit confused about, as you are with the habit.
Sorry, sir.
Can you
Like
hear
I'm
me,
not
Mary?
able to hear
Mr.
you.
Gary,
Yeah.
your connection, I think there's some problem. It was not clear.
You have
You can
addressed
put it up in the chat box.
it as a disease and a habit at the same time.
Like that. Yes. Okay.
Sorry, sir.
She is asking whether it is a disease and a habit at the same time.
Yeah.
Shall I message Shall I message you?
Yeah, you can
Yeah,
put it in
sure,
the
sir.
chat
Yeah.
box, Mr. Carey. Yeah. Okay. Anybody else have any observations, or anybody want to congratulate her and Richa? Both of them did well. Okay. Okay, Ronnie. Yeah, take over.
Let's move on now. Is Raman here?
Yeah, Raman is there.
Yeah. The thing
Okay,
is, I don't know how to share it from us. Okay, let me just see. I hope I'm able to find it.
if you can't do it, Raman, I can share it also.
Yeah, I got it. Unsupported. It's saying it's an unsupported PDF. So what do I do?
Or is it?
Can you please share it from your side?
Share
Give me a
screen.
second.
Yeah.
Because I'm trying to share here, but it's saying it's an unsupported document. I don't know what that means.
Will you be able
Oh.
to do that, or
Plan. We have 3 centers currently. One center is in Pune, another is in Mumbai.
who is speaking? No question.
Is the
Yes.
screen visible?
Yeah.
Okay, Raman, go ahead. Your time
Yes.
starts now. Okay, finish it. In
Okay. Second, first one. Yeah. Sorry, I'm having some trouble with this.
Ronnie will change.
Okay.
You can start.
The title of my presentation is describing recovery coaching to the client. Okay. So I was at my desk one afternoon when I got a phone call, and I heard a female voice at the other end, and I asked, "Hello, this is Raman speaking. May I help you, please?" And she said, "Yes, sir. I'm so and so, and I've just finished. I'm about to complete my treatment at this so and so center, and the chief counselor, he asked me to talk to you. He said that you are a recovery coach, and you will be able to help me in my recovery. So can I please talk to you for some time?" So I invited over, and when she came for the consultation, I said, "See, first, I would like to know about you. Would you like to share?" And she shared about herself, and I congratulated her on completing her course of treatment and the abstinence achieved. And within that half an hour, whatever ideas I was trying to get through, I was trying to emphasize that it's a collaborative effort. Recovery coaching is very person-centered. Therefore, it has to be very collaborative between the client primarily, and then what the recovery coach is able to do to facilitate that. So, and I also looked for cultural specific things or issues, because we need to be sensitive, because this girl was from a particular, this woman, was from a particular community that is quite orthodox. So I try to, keep that in mind also. Ronnie, you have shared it. Can I have the next slide, please? Yeah, thank you. And the basic content was, I also, during the course of that conversation, explained a little bit of science of addiction and recovery, what is the need for having, recovery support, and the relapsing nature of the disease, strength-based approaches, and, stigma and its effects on addiction and recovery. And because I felt that she had two areas that might be quite sensitive. First of all, she was young and married also, and she also, being a woman from an Orthodox community, had quite a few issues to actually negotiate. But I assured her that in spite of all that, whatever roadblocks or obstacles might spring up, women in recovery have certainly learned to negotiate them successfully through social skills and communication skills. And I also told her, look, we are not going to look at any negative part of your life or your history. We are going to concentrate on a strength-based program and on your personal assets and recovery capital. And we just set about trying to find one or two strengths. And one of the things that was a very strong point was her gratitude. She was so grateful that at this young age she was able to get treated for this addiction, which she did not know was a disease. etc., etc. And Ronnie's next slide, please. Thank you. And I explained to her, look, you might have heard of counselors, you might have heard of doctors. I'm sure you have, all of them were there to help you, psychiatrists, nurses, clinicians, and all that. But recovery is supporting is a little different. Recovery coaching is a little different from all that in the sense it is certainly similar to case management. However, case management is a very clinical setting, whereas here it is more field oriented. So then I also talked to her how recovery coaching is basically connected with the aftercare services at the rehab. And also I found out from her that she has been introduced to 12-step programs and recovery meetings. And this was a very great strength. It a community strength that I was able to identify, and I told her so. And also that in the community that she lived in, there was a lot of counseling services available, and also medical, psychiatric, educational, legal, and family services were available. Because of my network, I was able to identify a few service providers who would most probably be useful in this team. Yes, please, Ronnie. Thank you. And what is recovery? Then I went about, trying to explain to her what is recovery. And I said, first thing is being restored to physical and mental health and social well-being. Many of us think that mere abstinence means recovery. I asked her and she said the same thing. And therefore I had to, gently tell her that abstinence is the most important thing in recovery. Without that, you have no recovery, you have no future at all, so to say. But after that, we need restoration to physical. And also very gently, I said, there are research statistics which say that almost 60% of people who have substance use disorders go through some kind of mental transformation in a negative sense. And therefore, we need to assess that. And also that, I'm not saying that you have anything, but a psychiatrist has done an evaluation in your treatment center, and I would like to look at those records, is what I told her. And then I also emphasized that it is not, see, I told her we were dependent on drugs. Now we don't want to be dependent on people to make all the decisions for us. And once our mental health and physical and social, well-being is restored, we will have a sense of, doing something for ourselves. We want to do something for ourselves. Therefore, we will be living a self-directed life that enables, that facilitates our becoming a responsible and productive member of society, which means that I can make my own decisions. I don't need my husband or my grandmama or whoever else to make those decisions for me. Of course, I will be open-minded to all that they say, but finally, I need to decide because I need to be responsible for my decision. And she was very receptive of that. And then, very importantly, I told her the concept that actually underpins our emotional health and purpose and meaning in life is something very important. And constantly we keep changing our perspectives, and constantly we get deeper and stronger meaning in life. And going forward because once we get meaning in life and we know what we want to do, our potential emerges and we want to achieve that true full potential. And this is what is recovery explained to her. Thank you, Ronnie. Next, please. And so I asked her, I've explained what recovery coaching is in a nutshell, so to say, but why do you need it? I said, see, recovery from substance use disorder is sustained and it's an ongoing process. It is never done and finished with, because we know that addiction sometimes causes permanent changes in the brain, and there are implications in that for recovery. Healing can take place, but powerful issues can emerge requiring extra support. And that is where the recovery coach, what he does is he tries to coordinate these various services and sees what is the
Raman,
sponsor, family, recovery friends, counselors, coordinate and harmonize the various and sometimes conflicting elements. Because there will always be some conflict also between the various family want her to, settle down, but she wants to study and something else will happen. And, they want her to have children. And whereas the doctor says not good, don't do it right now, etc. We need to harmonize all this in a proper way and serene way. Yes. Here's Ronnie. Next slide, please. And I also said that we understand that recovery is dynamic. It's not always just like motivation is very dynamic. I am motivated today to do this and, to do a presentation, etc., etc., and, be a happy person. But sometimes that motivation just fluctuates. Sometimes I'll be over-motivated. Sometimes I'm under-motivated. So same way, recovery also, we need to learn how to enjoy life on a daily basis. But there is also times when we go through these tests and tribulations, and they call it living life on life's terms in NA. And sometimes recovering people find it very hard to cope in a crisis or to get ahead in their recovery all by themselves. And, that is why the recovery coach also helps them to negotiate the uneven path that addiction recovery sometimes takes. Next slide, Ronnie.
Raman, you have 30 seconds more, okay?
Yeah, the role of family and community. The family and community are the recovery access points. Without a functional family and responsible community involvement, the recovering person's risk factors will be active. The focus of a recovery coach is to facilitate the achievement of a healthy and recovery-oriented family and an acceptable, responsible, and productive community setting. These are the two very important, crucial, and decisive elements: role of the family and the community in recovery. Is to always be kept in ahead of our in front of our in view. It's always to be kept in view. Yes, next slide, please, Ronnie. Yeah, this is the end of the session, and next I've told that this is the end of the session and mentioned that there'll be specific content, structure, and delivery of the recovery coaching program, which will be offered if you decide to take it up, and duration of recovery coaching services, and then informed consent, confidentiality, and limits, and of course the fees. And this last end of the session, I basically gave her the ethical outline of what I can do for her, what cannot be done. Yes, and those are the references I've used. Thank you.
Thank you, Raman. Good.
Thank you, Mr. Raman. That was very nice. We
know
have few seconds for any questions.
Yeah.
The podium is
Thank you,
open.
Ronnie. Thank you very much.
Any comments from anybody? Recovery coaching, very important concept. He has given a very practical sort of a presentation about recovery coaching. So any observations, any questions? One question, one observation. Anybody want to praise him? Okay. Revati is saying something. If you can unmute, great.
It was very informative.
It was very informative. Good, Raman. So you have it. Yes.
Okay, let's move on to the next because of the constraint of time. Let's hurry it up. We don't. I think Devika and Dheera is not here. If you are here, please raise your voice.
Dheera is here. Dheera is here. Odira Lang was here. I don't know whether if here. Irene is here.
She has headlined.
Okay.
No problem. If she comes later on.
Yeah,
She has gone to do deadlines. Yeah.
Okay, no problem. Yeah.
Okay. Next up is John Smith. John Smith, are you ready for your presentation?
John.
Thank you. I'm just going to go into screen share.
Okay, Mr. John Smith, you can share your PPT if you have it. Oh.
Can you see it? Can you see the PowerPoint?
John. Yes, John.
Okay. Okay, my name is John. I am one of the ARCO therapists, and I'm also a therapist at an international treatment center in Thailand. And I'm just going to do a very, very brief overview of the relapse process and the theme that triggers are secondary in relapse. And I know there may be sort of confusion about the topic. Most of us have always believed that triggers cause relapse for the person in recovery. And the reality is, if triggers cause the relapse, then every single person in recovery doesn't have any hope, because they will be triggered for the rest of the person's life. The 12-step program states that the relapse is a sign of reservation in my program. So we're going to look at what the reservation is that ultimately maybe makes the trigger more relevant. And just very basically, quickly, a reservation is the story in the back of my mind where I may give myself permission to stop doing the work I've been doing for recovery. And the next step is then where I can give myself permission to do certain things that make it more at risk. So briefly going to run through what happens from a psychosocial, a biopsychosocial point of view during the relapse process. There are triggers or cues. However, as I said, the reservation is really what is problematic. And reservation is basically in biological, psychological, social, and spiritual areas. Biological, for example, if somebody suffers physical pain, they may have in the back of their mind, without even realizing that very often it is unconscious, I may need to use something in order to relieve my pain. Psychological, maybe somebody who battles with depression or anxiety, who maybe for a number of years was able to remedy the symptoms with whatever the substance may be, may still have that idea in the back of their mind. Maybe one day, if my mental health really deteriorates, I may need to use it again. Social, maybe a person is very introverted, really struggles to communicate, and maybe again trains themselves over many years by having a few drinks or whatever the case may be, they are able to socialize better. The same principle. And spiritual, just a sense of connection, morals, values, all that kind of thing. So I think it's sort of clear that in these areas, I may have certain beliefs, certain reservations in the back of my mind of why I may need to use again. There are two principles that support the whole idea of reservation. The place where I might get to where I give myself permission to put myself at risk. And the one is the denial that the person goes through, and denial for the recovering person is basically the rationalization, the justification, and the minimization of what they may be about to do. So there is a trigger, maybe there's a bit of craving, so the reservation kicks in. And so, for example, it may be the person's experiencing some mental health challenge, depression or anxiety, and the denial is then they rationalize. So the person explains to themselves why they need to use something. They justify, they give themselves the permission to do it and minimize. Famous last words for most people who relapse, just one more, or this is the last one, or at least it is not my drug of choice. The next thing that then kicks in, by the way, this all can happen within a split second. And the person is generally not even aware of this process. So once the denial is there and the person still doesn't realize what is happening, because this is now the worst case scenario for a person who ultimately relapses, the character defects kick in. And the character defects are all the survival and defense mechanisms that the person may have developed throughout their life and also throughout their addiction. And for example, I had a client a number of years ago who shared this with me where he started to crave alcohol, and he immediately rationalizes himself, to justify and minimize it, and the next thought that came to his mind is, well, I will need to stop off somewhere and get some mints to hide the smell of liquor. So the character defects, the dishonesty, the trying to get away with it, immediately that comes in, it becomes part of the person's thinking. So as you can see, the reservation was triggered by the trigger. I know that's not really good English, but that's basically what happens. And the moment that happens and the person is not aware of it, or they don't use the tools, or they don't ask for help, the denial kicks in, because that happens with any kind of action. I have to give myself permission to do what it is I'm going to be doing. And people in recovery, by their own admission, will tell you how good they've become at rationalizing why it is okay to do it, why I need to do it, and it is not really a big deal. And then the character defects that try to cover it up, trying to get away, that kicks in, and that starts to affect the behavior. Then again, if that is not addressed, the addict behavior kicks in, and we all know the addict behavior is, as was intimated by some of the previous speakers, that it is a part of the brain that has been programmed to help me to deal with my anxiety and my depression right now, because I had trained this part of the brain over many years, that this is how I deal with it. So the addict behavior at this stage that part of the brain kicks in. And there's a process called hypofrontality where the thinking rational brain literally goes offline when the survival brain kicks in. In this case, this person is not using the tools, not asking for help, and the process develops, the denial kicks in, the character defects are kicked in, it's making perfect sense to this person what they need to do, and they start to act out. And acting out, obviously, is just a euphemism for actually using. So the acting out is the person picks up. And they use, and the next thing is after a day or two, or however long it takes for the person to get back to their rational thinking, they are aware of the consequences. And it's normally a case of, oh my goodness, what have I done? And if it's somebody who has family around them, the family will start to accuse and judge, but how could you do that? You promised you would never do that. So what goes with consequences? Guilt and shame. And very often that again perpetuates the situation because now the person is feeling guilt, is feeling shame, and the whole process kicks in again. And this is one of the reasons there is a belief that so many people who relapse will go into binges and they will keep using for quite a long time. And one of the reasons is the feeling of guilt and shame that they experience, so they keep repeating the whole process. So that is basically just to indicate that triggers are secondary in this process. It's the reservation or the reasons I give myself. And the rest is basically an unconscious default reaction within the second. So how do we deal with it? Well, that will have to be another presentation for another time. What can I do to address those triggers in a biological, psychological, social, spiritual area? Thank you for giving me the opportunity to share.
Thank you, John. Any observations, appreciations, questions, doubts? Half a minute.
John, nicely.
You're breaking up very bad. I can't hear the question.
Network problem. I think he's trying to appreciate you anyway. Anybody else?
That's the
very
comment.
well presented, John.
Presented well. Manish, very good. Tiara was saying something.
I said on the chat, sir.
Okay.
Everyone, presentation very clear, cool, and informative. Thank you.
So John, good.
So many things on one slide. Wow.
Process. Yeah, just one slide only. Okay, but so many things. The cycle of relapse.
Sir, he explained relapse process from a very different point of view, putting so many things together in one slide.
Very good. Okay. Very nice. John, good. Okay,
That
Ronnie.
was a wonderful presentation, John. Now we have Manish Sukla, who is ready to give his presentation. Manish, he will be presenting with two contents. Should I share it right now, Manish?
Yeah.
I would request everyone to mute while the presenters are presenting. Okay, Manish, you may begin.
Yeah. Good evening, everyone. And I would like to really thank Dr. Thomas and alumni to giving us the opportunity to represent our skills. The topic what I will be presenting is the risk factor for substance use, or in the layman language, I will say, why do people become addicted? Can any one of the alumni can tell me the reason why people use psychoactive substances? Anybody?
Curiosity, peer pressure.
Exactly.
There is also a family history of addiction involved.
Exactly, madam.
And also in other environmental factors like predisposition towards that due to some cultural influences also.
Exactly,
Lifestyle.
Raman. Environmental and cultural factors. Yeah.
Yes, sir.
So yeah, this is some of the reasons why people use psychoactive substances. Is out of curiosity. Friends are doing it, so let's go and do it. Somebody do to celebrate and feel good. Somebody do to perform it better or to feel better. Whatever the reasons may be, but no one ever plans to become addicted. As per the survey, we have a majority of populations who are uh, experimenting drugs or who are using drugs, but very small proportions of this population, they progress towards substance use disorders. So the vulnerability of addictions differs from person to person, but overall, the risk factor is affected by both biological and environmental factors. Just as Raman said, there are many environmental factors. So biological and environmental factors are the root cause which increases the risk for addiction. We have, when we look towards biological factors, it has three variables: genetics, gender, and mental illness. So when we talk about biological, so we say the family member or parents who is having a history of substance use disorders or who are continuously using psychoactive substance, or they engage in criminal activity or domestic violence, they have much more chances of their children to get into substance use. Even the persons, when we talk about the population of male, are much more prominent as compared to women, especially the sex effects of men. They use psychological substance to have longer sexual pleasures or long-lasting effects. So these are the chances that may develop them toward substance use disorder. Apart from this, a mental illness where a person suffers from PTSD or stress disorders, they take psychoactive substance to relieve their stress, and by continuously taking this substance, they develop SUD. When we talk about cultural or social practices, in our cultural and social practices where the factors which encourage more drug abuse or more substance use, the chances of addictions are more. Whereas where there are low discouragements towards the substance, it can reduce the level of addiction. Same as we talk about the family or the acquaintances or the friends influence during adolescence, but they can influence at any age. Lack of family or other social support or poor skills or traumatic experiences and similar factors, it also increase a person's risk towards addiction. Even how the substance use is also a big factor. Smoking or injecting a substance which increases addictive potential. Both smoking and injecting it enters the brain within a fraction of seconds, which produce a powerful risk of pressure, developing a person to use again and again. However, whatever the reasons, whatever the risks are there, a person never plan to get addicted. So we at ARCO Therapy, we provide a proper psychoeducation sessions to those who needs to understand what are the risk factors, and they can get themselves prepared to get in the trap of addiction. Thank you.
Okay, Manish, good. Very precise about the causes. So what makes a person addicted to substances? So anybody wants to comment on it? Anybody want to comment? Yeah.
Manish ji.
I presented Dr. Manish. Thank you very much.
Thank you, sir.
Great presentation.
Compliment.
What all I would like to add that, you know, people, they just want to be the part of the group. The sense of belonging.
Yes.
That point can be added.
Okay.
Yes, sir.
Yeah. I think he mentioned that initially.
Yes, he did.
Okay.
Manish ji, by far the best presentation. Seriously.
Thank you, sir. Thank you very much. It's a pleasure.
Very precise. Very good. Okay. Anybody else? Any questions? Anything? There's no break today. Okay. You want a break?
Dr. Thomas,
yeah.
I think we must stop making it into a competition. It's not a very healthy. Yeah, just now, Vikas, the comment he has made,
he
might
gave a
discourage
comment.
others, you know, and make them a little nervous. All of us are doing our best. Please do not make such comments, Vikas. Negative.
Raman,
Very negative.
Raman, nobody can make you nervous, brother. Nobody can do that.
Raman is exceptional. Yeah.
You're the king.
Nothing like that. Yeah. We are all equal.
Yeah. Okay. Ronnie, are we giving 5 minutes break or we just go ahead? Huh? What do you think? Shall we?
What do you guys think? Do you guys need break? We have still there are a few people who are waiting to present.
How many more, Ronnie? Now 6 people finished, I think. No, another 5.
5.
Yeah, we have. Yeah, only a few more people to go. Actually,
Yeah.
We can get a break.
No problem. So you can have some discussions also in between about the topic, like no. So if anybody want to add some more points, so those kinds of things are welcome, definitely. Because 7 minutes, it's very difficult to put everything together. So yes. Definitely, yeah.
If there is, are we taking the break now?
Do you want a break now, or shall we go ahead?
5-minute break. No break.
No break. So shall we just go ahead so that now we can maybe finish also a bit early.
Yeah, once we finish the session, you guys can take a
full break. Yes. Yeah. So go ahead with the.
Okay. Next, we have Tiara. Tiara, I hope you're ready with a good presentation. We're all looking forward.
Okay. I thought we are going to take a break.
No. So.
Okay. Let me share my presentation. Wait, please.
Yes.
Okay. Can you see everyone my presentation?
It's
Yes,
on.
Okay. Wait.
I think it's done.
Okay. Okay, I'm going to start my alarm for 7 and 30 seconds. Okay, everyone, thank you for this opportunity tonight. I'm going to present about mental health. This is the part of motivation theme, and the theme is mental health. Okay. This is who am I? My name is Tiara. Everyone, I'm from Indonesia. And I'm a bachelor psychology, and I had my own community. The name is Trident. Trident, the tagline is work with compassion, and I'm also part of ARCO Addiction Therapy. This is my email and my community Instagram, just in case you want to look and see my community. And this is the presentation. World Health Organization. Health is a unity of physical, mental, and social well-being, which is a unity, and it's not merely the absence of a disease or conditions. That's from World Health Organization. Health is include mental health and physical health, like it's going together. Physical health like exercise, mental health like we're doing something to take care of ourselves or me time and something else. This is what happy human looks like. A healthy body plus healthy mind makes a happy human, like that. And the next, we will talk about physical health. Physical health is include a physical activity like running or doing some exercise, and then we eat healthy food and quality sleep. Okay, the topic is about mental health, so I will explain about how to become a happy human and mentally healthy people. We need to care about physical health also. Next, this is about mental health. Positive mental health might look like being kind to yourself, positive coping strategy, thinking skills, set and achieve goals, social skills, seek resistance, using problem solving skill, not using the things, building self-awareness. This is a part of what can we do to build positive mental health. This is a toolkit. And then next, let's talk about mental health. Why this is so important? Because related to addictions, really mental health is related to addiction and other things in our life. Next, like a failure, we might have pain, tired, frustration, sadness, depression, anger, grief, silence, sorrow. And then for the teenager, maybe look like peer pressure, bullying, like anxiety, attitude, depression, performance, mental health, verbal, appearance, and physical. And of course, addictions. Nah, the cycle of addictions, drugs looks like urgent needs, all behavior pattern, unsatisfying outcomes, confusion, frustration, pain, fears. That's why we need to take care of ourselves, physical and mental. It can lead to drugs also. Now, this is some of quotes. It's okay not to be okay. Maybe familiar with this quote. And then it's okay first to make a mistake, to have a bad days, to be less than perfect, to do what best for you, to be yourself. You can put this kind of quote to yourself. And what to do? We need to aware of ourselves, accept, forgive, let go, and love. Love ourselves and love the other. Now, how to be self-aware? We need to know our needs, our skill, personal interests, value, hopes, and dreams. That's what we need to aware. And then how to self-care can be look like asking for help, spending time alone, putting yourself first, asking for what you need, taking a step back, or maybe forgiving yourself, saying no, staying at home, setting boundaries, asking for what you need. This is some of the quotes. I'm not perfect, but I'm pretty good too. Okay, next. Okay, ini how to forgive. To forgive is to set a prisoner free and discover that the prisoner was you. Now, we need to know and try to understand ourselves and forgive everything that might be something to us. Let go and be free. And the last one is we need to let go and be free from everything. Okay, this is some quotes. Talk to yourself like you would to someone you love. This is really recommended. We need to love ourselves and love the other. We need to take care of ourselves first. We need to promise to ourselves like love myself first, appreciate myself more, always speak kindly to myself, be honest with myself, not afraid from a challenge, invest in myself and get what I want. This is love looks like. And of course, we need support. Support is very important for everyone, for every people who drug abuse, substance, and yeah, support. Okay, special thanks to myself, of course, ARCO family, and Google Image who helped me with this presentation. Okay, thank you.
Wow.
Very nice. Very nice, Tiara.
Thank you.
Yeah. Special thanks to myself. I liked it.
Yeah.
That is a sign of mental health, real mental health.
That is.
Okay, it was a very nice presentation, Tiara. Congratulations. Clear,
Thank you, sir.
colorful,
Really fun, Tiara.
and it deserves like a break also. So people are.
Thank you, everyone. Thank you, sir.
Any comments? Any questions? Any problems? Anybody? Jyoti is appreciating you. Anybody who has to say something about?
Very well presented, Tiara.
Manisha, yes, good presentation. Yeah, everybody did, starting from Richa. Richa, I didn't give them chance to tell you. It was nice, but very good. Okay. Tiara, fine. Anybody else?
Everybody did well, sir.
Ah, wonderful. Good. Okay. So, yeah.
So that was really good, Tiara. We all of us, I agree, everyone enjoyed your presentation.
Good presentation. Yes. Okay.
Yes. I think some people are feeling a bit tired. Shall we give a break because there's only 3 or 4 more people?
No need. I think, Ronnie, because since it is Facebook Live, so let's just continue and finish it. No.
Okay. Surely. Okay. So, Dr. Denzil, you're next. Are you here? Dr. Denzil? I can see you here. Okay, Denzil, you can share your PPT if you are indeed presenting with the PPT.
No, I'm
or
not
else it's fine.
presenting a PPT. I'm just giving an oral presentation. I'm in my office now. So, so I'm talking about alcoholic and disease addiction aspect of it, and I would like to ask the group a question. What is lawyer and advocate? Anybody?
Question to everybody.
What is the difference between lawyer and advocate? Okay, let me answer myself. Is anybody?
Lawyer is the
Lawyer is a
advocate
practice.
is a highly
Lawyer is a person who practices the law, and advocate is a profession.
Yeah. Okay. So it is anybody who has done law degree or a professional qualification is lawyer, and one who is practicing that is advocate. So same way we have a drinker and an addict. There's two things are there. So here the family has no information about the disease aspect of addiction. So they say he was a nice man and he started drinking and the whole life has ruined and we are not able to control him. So there's a point where they are distressed and they're hopeless and confused and they have a lot of anxiety. And here is the point where they seek help. So they come to a center and all those things. And now we are here from this side of it where we have to give a psychoeducation or educate them about this aspect, this disease aspect of addiction. So family is really confused and they don't know what to do and they don't know what's going to happen to the member who is going to be admitted or who has this problem of drinking and all those things. So the counselor or the person who is there has to give an education. So they have to build trust. They have to give confidence to the family that this is a disease and this which can be treated, which can be controlled. Need not worry. So we have to create confidence, trust, and first of all, we have to relax the family, make them feel relaxed, and make them feel that they have come to the right place, and this is treatable and controllable. So the family has to be educated about the disease aspect of it. So not going into the technical aspect of it, we can simply explain them about what is the difference between an alcoholic and an addict. So the primary three differences are that alcoholic also consumes alcohol, but the addict, what happens is he slowly his brain and his body become dependency to this material, whatever it may be. So first aspect we need to educate them is that this body has become so dependent about this alcohol or whatever it material. So that is the primary difference between these two, alcoholic and the addict. First is the dependency. They are not able to be there without this chemical or this product. So that is the first thing, and they are not able to control the use of it. So the first thing is the severe dependency. Second thing is that they are not able to take care of themselves, self-care. Second thing is not self-care is not there. So we see the patient not able to take bath, have brush, or have a clean dress and all those things. So first is dependency, second is self-care, loss of self-care. Third is they are not able to do their duties or execute their responsibility. For example, he may be a father, or he may be a son, or he may be an husband, but he is not able to do his family responsibility, and also he may be employed. So there also he is not able to execute his routine jobs and are not able to go to his jobs and all this. So these are the three factors that we have to inform the family that these are the things that indicate to be an addiction, the dependency. There is no self-care and he's not able to take up his duties because of this chemical going inside, and this whole thing is called as a disease, and this disease is called as chronic brain disease. And I'm talking about alcoholism. So we have to educate the family, and we have to tell them how the treatment is going to take place. First, the treatment will be care of the physical components of hunger, sleep, toilet, and all these things. Second thing is explaining to them about the damages, and third thing is about prevention of this disease. So the family has to be first stage; they have to be educated, and then the patient has to be admitted. Second stage, when the patient starts learning and other things, we should have an interaction with the family where the family interacts with the patient, and the patient may be in different stages. Maybe will have resentment, or maybe guilt, or he is worried about the damages that the disease has caused to the family and other things. So second stage, we talk to the family and explain them that this is not the person doing all these things because of this disease that this person is behaving like this. So we are trying to separate the disease and the person. So the family is able to see the disease separately and the person, and they are educated to handle the disease, and they are educated to handle the person separately, so that they could see that because of this disease this person is behaving such and such a way. Because he has dependency, he's not able to take self-care, and he's not able to do his routine duties. So the family has some understanding, and once after a month when they meet the person, they are able to have an sympathetic and they forgive all those things, and they are able to look at the person in a different perspective, because now they know that it is a disease. Our family member has got a disease, so they focus on how to handle the disease. What are the medicine he has to take, what are the things that he has to do, so they focus on that. And even the patient also is aware that he is having a disease. So it's very important that we educate the family about disease concept of this alcoholism. So otherwise, it's very difficult for the family to understand the patient. So we have to separate the behavior and the disease, person and the disease. So there are three ways. There's a family, there's a patient, and we are service providers. So we all should work together and slowly keep the family reconciled and bring out with an action plan, and all those things has to be done systematically. So primary goal of bringing the family here is to build a recovery capital, and the family is the most important and the very basic recovery capital that a patient has. So the family has to be well educated, and they have to visit the patient, and they have to have a conversation with them. They have to reconcile with everything that has happened in the past because of this disease concept. And finally, the family and the patient should come out with an action plan for the future. And this disease cannot be cured as diabetic and BP and other things. So the family has to be educated to handhold them and to help them to live a happy and disease-free life. So this is very important that the patient is informed about disease concept, and also the family is informed about the disease concept. This is the basic of our treatment. So we should focus on this and give time so that they understand the disease and the patient and how to handle all these things.
Thank you. Thank you, Edwin. Good presentation, the difference between substance use and substance use disorder, or the difference between what is alcohol use and alcohol dependency. And then the importance of the family to get to know the disease concept of addiction, so that we would be able to deal with the issue of addiction in a comprehensive way. Thank you. Any comments from anybody?
Yes, doctor, I really like the way you emphasized the separation of the disease from the person.
Correct.
It's like we can't call somebody a schizophrenic. We can say that he has the disease of schizophrenia. Same thing, we can't call a person, that, because it's stigmatizing, it's a stigma.
Yeah. Thank you, Raman. Thank you for the good point. Yes. Anybody else have any comments?
Yeah, I'm
Yeah.
So most of the things when the topic came, each one was introducing the topic. We thought it's something we might have learned, but each one have added something from their experience, and it's something new to learn and know also. And that was something special in this whole team, and a good presentation from all of them, and something new to learn and get to know also. And that was fine. I enjoyed all that part of.
Thank you, Arun. Yeah, everyone had something new, something specific. Very good from their experience. Yeah. Okay.
Thank you. Then that was a wonderful presentation as well. Up next, we have Madam Revati, who will be presenting her topic. Revati, you will be using your PPT as well, I believe.
Is my PPT audible, sir?
PPT is not come. You share it, okay? From the share.
I'll just share, sir. Can you just help me do it?
Ronnie,
Yes.
do you have her copy with you?
I don't have your PPT.
Yeah.
But,
I shared.
No.
Okay.
Just 1 minute, sir. Just give me a minute.
Madam, if you can share the PPT to me on my WhatsApp, I can share it.
Just 1 minute, sir.
Take
I
your
think
time.
The sharing is in the PPT.
It's in the bottom.
I'll just
There is
try.
a share screen button in the bottom.
Revati, don't worry. You just present it from your PPT. Don't worry about sharing.
Okay. I'm Revati. I thought it will be more impressive with the PPTs, but sorry, sir, I could not get it now. I'm Revati. I'm going to present on codependency. As we all know, addiction is a disease. It is a brain disease. And addiction is a family disease also. Am I audible to everyone?
Yes, ma'am.
Yes.
Yeah. It affects the family in the same intensity with which it affects the addict. So, someone who lives in a committed relationship with an addicted person is a codependent. The topic I'm going to present for you is on codependency. Codependency is a condition. Codependent is a person. Codependence can be spouse, children, parents, and siblings. . I got it now. Are you able to see, sir?
No, Revati.
Okay,
Go ahead.
okay. The family codependency, the codependence can be the spouse, parents, children, and siblings. So living in a problematic situation, the family develops what is called as codependency behavior. Now, what is codependency is, it is a set of maladaptive compulsive behavior of the family members. It is a response to emotional pain and stress. There is a codependent is a person who is preoccupied and has an extreme emotional dependence on the addicted person. It affects all other relationships also. So anyone whose life has become unmanageable as a result of living with a committed relationship with an addicted person is a codependent. Now, there are certain unwritten rules prevailing in the family of the addicted person, not to talk about the family to other people, not to express their feelings to other people, not to have any fun when there is a problem, and not to rock the boat, in the sense that as it is, a family has a lot of problem, and the spouse is not expected to add more problems to the family. There are three stages as we go through the disease of addiction, which is primary, progressive, and treatable. Here also there are three stages of codependency. The first is the normal problem solving and attempts to adjust, which means that in any normal family, when there is a crisis, when somebody is in pain, we try to take him to the hospital, we ease the crisis. If there is a dysfunctional member in the family, we'll help him to become normal. This happens in a normal family. Whereas if it happens in an addicted family, if we take the same measures in an addicted family, the problems get aggravated and we don't get the necessary results. The outcome is very negative. The second stage of codependency is habitual self-defeating responses. That means the family members continue to do the same thing. For example, the patient may say that I have debts to the tune of 50,000. You clear my debts and I will stop my drugs or drinking. So the family member goes out of the way to borrow money. She repays all the 50,000 debts and thinks that so the family thinks that by clearing off his debts, they will stop drinking or taking drugs. So it is a self-defeating response. It makes the addicted person more irresponsible. The more the family members try to cover up, protect the addicted person, the problems becomes more and more, and the addicted person becomes more and more irresponsible. The chronic stage is family collapse, and there is stress degeneration. The responses of the family members becomes repetitive, in the sense that she tries to call up the office people and ask whether he has come for work. She will search for his bills in the purse to find out if he has had alcohol from the wine shop, and so on and so forth. So the family's behavior goes out of control. There are certain symptoms of codependency, like symptoms of addiction. The first, we will talk about the feeling level symptom. The family will have intense preoccupation with the addict, like how the addict is preoccupied with the chemical. The family member is preoccupied with the same chemical which influences the addict's behavior. Then the family goes through a lot of fear and anxiety because she doesn't know what will happen to the family, whether the children will get educated, whether the person is going to be alive or not with his addictive behavior. Then the family has a lot of anger and resentment. The anger is because why she is not able to help him stop drinking or taking drugs. And resentments, lot of resentments built in the family members. Then self-pity. The wife dwells in self-pity because she's not able to control his drinking or drug-taking behavior. So automatically her self-esteem becomes very low. And because there is constant accusations from people around the family that she is the cause for his drinking or drug-taking behavior, all the more her self-pity becomes more. Always looking for others' approval. She wants everybody to approve her behavior. Then attitude and behavior level symptoms are loss of daily structure. For example, in an addicted family, there is no daily structure. The wife doesn't get up on time, doesn't prepare food on time, doesn't send the children to school on time. She doesn't go to work on time and things like that. Lack of personal care. She doesn't take care of her health issues like dental problem, whether she has any gynec problem or whether she has any problem with her vision and things like that, which has to be attended very early and immediately. She just keeps on postponing. And also she doesn't groom herself well. She doesn't wear any good sari, doesn't clean her face, or doesn't care about her hygiene, and doesn't have a good proper makeup and things like that, which she can afford to do. Then there is inability to set and maintain limits, in the sense, in every family we have rules and regulations, whereas in the family of an addict, the rules are either too lenient or too strict. For instance, in one instance, the son comes 10 minutes late, he's sent out of the house. And other day, the son comes 2 hours late, no action is taken. So there is no limits and there is no consistency in disciplining also. And inability to maintain interpersonal relationship, because she thinks whatever she does is right. And she doesn't take the advice of other family members. When they suggest something good, she doesn't take it. She always says, whatever I do is right. For example, if the son is doing his studies in the city school and he is not able to study well because of the father's addiction, the mother decides to send him to the grandparents' place, which is a very small town, to a small school. The other members of the family disapprove her behavior and her attitude, but she doesn't care for anything and she will continue with her own attitude and behavior. Then attitude and other behavioral level symptoms are, there is no planning at all in the family. Addict has his own problems. He's preoccupied with drugs and drinking. He doesn't plan or prioritize anything. The very same way, the wife is also behaving the very same manner. She doesn't plan and prioritize. For example, if the college fees has to be paid for the son, she would have borrowed some money and kept it in the cupboard. But when the husband demands and beats her up the overnight, she will give away the 50,000, not thinking that she has to pay the fees for the son the next day. So indecision, always she lives in indecisive manner. She has she's not able to make decisions at all. Even for simple things like, should I go and visit my mother? What saree should I wear today? Should I dress well, or should I wear this jewel or not? Even small things like that, she is not able to make decisions. She has trouble asking for help. She doesn't want to take any help from anybody. She's very hesitant, because if she's going to ask for help, people will ask reasons. Then she has to reveal the problem of addiction in the family, and she doesn't want to do that. Scapegoating. All the time the family member starts blaming the other family members for where you have to blame the addict for the reason, the family member will start blaming everybody. For example, if the son doesn't do well in his maths exam, the father is taken into task. If the gas is not operating well, again the addict is pointed out. So everywhere, for whatever thing happens wrongly in the family, any mishappening takes place in the family, the addict is blamed. So there is a lot of scapegoating. Then there is lots of faith in higher power. All along, she has been praying to God that she should help the husband come out of drinking and drugs. Because constantly she has been praying. And finally, there is no result to it. She thinks that there is no point in seeking faith in higher power. Then the summary of all this is how to help the family members recover from codependency. First of all, they should identify that they have codependency traits. They have to take care of self. They have to take care of their personal recovery. They should know the difference between what is a supporting behavior and what is an enabling behavior. Supporting behavior is a constructive form of helping, whereas enabling behavior is a destructive form of helping. Then she should understand that she is powerless over the addicted person and his addiction. Thank you, sir.
Thank you, Revati. We are reminded of Madam Thiru when we are listening to you. Okay.
Correct. I have the same very minutely detailed. Thank you. Thank you, ma'am.
Thank you, sir. Thank you.
So, Revati, you can share your PowerPoint with us later. I'm sure it would have been very good, but we didn't want to disturb you in between. If you so wish, you can share that PowerPoint.
I will try to share it immediately at the best of my ability, sir.
Even later also with the group. Okay, everybody can. If you are interested to share your PowerPoints, you please share with others also. Okay, it was a very important topic about how family is affected, how family goes through when there is a addicted person in the home, like very important topic, and she has put it up so nicely in a very professional way. Congratulations.
Thank you, sir. Thank you, sir.
And Dr. Thomas, if I may add, I must say that she brought out the various roles in a codependent family, dysfunctional family, the enabler, the scapegoat, the clown, or the hero. You brought up all these things very well. Very nicely done, madam.
Thank you, sir. Thank you, sir.
ரொம்ப நல்லா இருந்தது. நல்லா புரிஞ்சுது எனக்கு.
Thank you, sir.
She has over 30 years of experience in PTK.
That is why.
You have to expect. Good. Yeah, so good. Anybody else? Anything else? How many more persons, Ronnie? 2 more, huh?
We have 2 more people.
Yeah, okay. So let's continue.
Okay. Thank you, Revati ma'am, for your wonderful presentation.
Thank you, sir.
Okay, next up we have Pramit Basu, who is ready with his presentation. Pramit Basu, will you be using your PPT?
Yes, I'll be using my PPT.
Okay.
I'm just sharing it.
Pramit, are you sharing your PPT?
Yes, I'm sharing.
It's coming, yeah. Click on, yes.
Okay, good evening, everybody. My name is Pramit Basu, and I have came up with the topic disease of addiction. So, firstly, we will know that what is disease of addiction? What is addiction? Addiction is basically a chronic relapsing brain disease, which is characterized by compulsive drug use and despite harmful consequences. Means we know that what consequences we are going to face if we use the drugs. We have faced it before, but we repeatedly, knowing the consequences, we use the drugs, and that affects our brain very badly, and that span of time can be very long. The changes of the thinking pattern on the brain functioning might last very long, and by which we see certain irrelevant behaviors in one person. How brain gets affected due to addiction. So there is a reward pathway in the brain, which we call feel good. So, like I like certain things which gives me pleasure. So certain chemical in our neurotransmitters secrete, like dopamine. Dopamine gets secreted when we feel good, and as the dopamine secretes, we want that feelings more and more, so that we can get more good feelings. And like that, like I can give you one example. When we use drugs, our brain functioning gets hijacked by the drugs. Like if you know that when a flight gets hijacked by a terrorist, the passengers don't have any control over the circumstances. They are powerless over there. So when we use drugs, the whole reward pathway gets hijacked, and through that we tend to use drugs more and more, and so looking forward to get my first experience that I had, my first kick that I had when I used drugs. But by doing that, I don't get that pleasure when I use drugs first time, but I get more and more tolerable. My tolerance power get more boosted up, and we become dependent on that particular substance. The disease have three parts in all. There are three parts of disease. Well, first one is physical, second one is mental, and third one is spiritual. Physical allergies contain loss of control, compulsion. Loss of control means when I start using, but unable to stop despite of knowing the negative consequences. Means I know how to how to start my using, but I can't stop because despite of knowing the negative consequences, I can't stop. And as we use more and more, I become more tolerable. My tolerable power becomes more, and we become dependent on that particular substance. And compulsion is, suppose I am using drugs for a very long time, and I am not able to take more. But that thinking that I can't take more, but my disease is forcing to go against my will and use. Means my disease is telling me that you use more, you can do it, you can do it. And I compulsively go and use more. Second one is mental preoccupation. Preoccupation means suppose today I am using my drugs. So while using in between, I start pre-planning things, how to get drugs tomorrow, how to use drugs more and more, how will that shop be open, how will I get the money from to get my substance. So if that shop is not open, I have to walk a mile more to get that substance. So this pre-planning continuously goes on my mind, and we keep on thinking the pros and cons, the alternatives. If I don't get this, so how will I get that? Like that. And obsession is the repetitive thinking of getting drugs or use more over and over again, leaving all other priorities. Means I ignore my families, I ignore my career, I ignore what people will think about me, but I am repeatedly thinking of using my drugs and alcohol. And third one is spiritual bankruptcy. The first part is self-centeredness, thinking and caring about my own worries and own self. I don't care what the others are doing or so on and so on. We make a triangle and we are consistent in that triangle. We don't allow others. When the triangle means me, my using, and my drugs. This triangle, in this circle, in this triangle, I get stuck, and we don't go out of this triangle, and we don't let others to get into this triangle. We don't allow others to get into this triangle, and we get stuck in this triangle, and we use more and more. Selfishness means I don't care you eat or don't eat, but I should eat and I should fill up my stomach. I don't care how much I eat, but I don't care even how you will arrange your one. But my eating, I should have my way. Like that, we get spiritual bankrupted. So the physical allergy and mental preoccupation leads to spiritual bankruptcy. And I came up with certain three of the major areas where we face crisis due to our addiction. First one is relationship crisis. Relationship crisis means due to drug addiction, we tend to ask money from our family members by lying them that we will go to some where to invest money in some other works, but we actually go and invest money on our drugs. And like that, we tend to get money more regularly. And when our family members resist me from taking the money, I get violent and react upon it. So what happens? This affects our relationship with our family member. Even this affects our relationship with myself. And when we create nuisance and when we create violence in our family, when we create violence in our family, naturally the other society members come to know about that. So the self-respect of our family, the self-respect of mind, the image, societal image which our family pursued day by day, all becomes down. Next is career crisis. Due to our addiction, we sometimes tend like that we use drugs and go to our job, and as a result I lose my job, and that red mark in my character affects me to find more jobs. So similarly, the students who are students, they bunk classes and go with their using partners to use more and more drugs. As a result, their career achievement becomes very low, and their interest in extracurricular activities presented by the school and their interest in attending the classes and mixing up with the friends who are good and mixing up and interest in their studies goes down. And the final is financial crisis. This is a major part which every addict and or substance use disorder people pursue. Like when we use drugs, we want money, we want more and more money, and as a result, certainly we come short of our daily expenses. Our daily expenses gets hampered, and after that, after some day we recognize that our monthly expenses get hampered, and like that our yearly. And as a result, and lastly, when we run short of money to meet our daily life expenses, we become depressed, and we become so depressed that we tends to use more and more drugs. So financial crisis is one of the major area where drug abuse can affect, and depression can lead to many thoughts like suicidal attempts, like depression can think that poor me feeling, I am very bad, for me everything is gone and all, and we tend to use more and more drugs, and the disease of our addiction gets promoted by this thinking and acting out what we are tending. Thank you.
Thank you, Basu. Yes, excellent. Yeah, this is the second, I think, session about the disease concept of addiction. Very good. You have very well explained the progressive nature of addiction, how people land into different issues. So excellent presentation, Pramit Basu. Congratulations to you.
Thank you.
Else? Yeah, want to comment on it? We have one more last presentation, isn't it, Ronnie? Just one more, yes, no? Yes. And I also recognize the presence of Aditi Ganekar here. Okay, thank you for being with us. Okay, so anybody want to comment on it? Yes.
Hi, everyone. So I'm quietly listening. Don't worry. Hi,
Okay.
Revati.
Hello,
Nice
ma'am.
to meet you. Jyoti, and I can say hi to everybody.
We had some very wonderful presentations, Aditi.
I know.
But anyway, it is there in the Facebook. I'll share with you. You can see it later also.
Okay, we'll continue, okay. Thomas.
Okay, Ronnie, over to you, please.
Thank you. We have one last presenter, Jyoti. You're ready, I assume. Jyoti, will you be using your PPT? If you are, you can share your PPT and then we can start. We cannot hear you.
Yeah, I think my PPT is visible now.
Yes.
Yeah, it is visible.
Yes, ma'am.
Okay, wonderful. So I am Jyoti Sharma Bharadwaj, and I work for ARCO, and I'll be presenting today about alcohol risk and harms. As we all know, alcohol is one of the oldest and most commonly used psychoactive substance in the world. And in India, the legal drinking age and the laws which regulate the sale and consumption of alcohol vary significantly from state to state. national survey on extent and pattern of substance use in India was done the report came in 2019, which clearly shows that there are about 16 crore users in India. As we can see that 17 times, the prevalence of alcohol use is 17 times higher among men than in women. And every third alcohol user is suffering from alcohol related problems. So this is the scenario which we have here. Out of when we see this scenario, as I said, we are talking about harms and risks. The most commonly used category of alcohol in India is country liquor, that is the 30%, and the IMFL, that is the Indian made foreign liquor, which is again 30% of the users are using. Why I am underlining this usage is because the concentration of alcohol is higher in this category, whereas when it comes to strong beer or light beer, there less of consumption as seen according to the data, which clearly shows that our youngsters are beginning to use concentrated alcohol in the initial stages itself. So the patterns of usage are indicating that they will go into alcohol use disorders early. I would like to highlight that the heavy episodic drinking, that is the binge drinking, was observed in 43%. So the pattern of drinking is really a question here, which indicates that the harm and the risks involved in alcohol drinking are great. Why do we use reasons for use? As many of the presenters have already highlighted, one of the reasons which was not spoken about was behaving like an adult. So many people, especially the young people, assume that alcohol usage is actually an adult behavior. So if they are going to use it, they basically will look like adults and responsible people. Another important aspect is that people think that it reduces the social anxiety or social phobia. So there are a lot of young people who are using alcohol because of this as well. Since it is a legal drug and the availability, the accessibility and the acceptability of alcohol is such that more and more people are reaching that drinking age, the legal drinking age criteria, and getting into this particular substance very quickly. Why do we, so what is alcohol? Basically, when we talk about alcohol, basically it is made up of agricultural products like cereal, fruits, molasses. We all know that, but nobody wants to drink it for the apple or the apricot or the sugarcane or the cereal in it. It is actually the ethyl alcohol for which it is consumed. And as we can see, the alcohol content of different alcoholic beverages is different, and the standard drink varies according to the concentration. When I say standard drink, it is the measure of the alcoholic beverage. That is the 10 mg of that particular beverage, irrespective of the kind of alcoholic beverage or the container it comes in. So that is what I will explain it to you in a more descriptive manner here. So when I say half a bottle of standard beer equals to 1/4 bottle of strong beer equals to 1 peg, that is 30 ml of distilled, that is rum, vodka, wine, rum, vodka, or tequila, and 1 glass or 150 ml of table wine, half packet of arak, country or desi sharab. So why I'm highlighting all these things over here is because many of the people who go into alcohol use do not actually understand how much and what of are they drinking. So this is one of the reasons why they drink more. And then all the alcoholic related problems emerge. So when somebody is having alcohol, it is getting absorbed. It is not digested. The 20% of it is absorbed in the stomach, and 80% is the small intestines I'm sorry, 80% of it is in the in small intestine, and it is basically metabolized in the liver. 90% of it excreted, eliminated from the body in the form of breath, alcohol. I'm sorry, I have a problem here. It says software update. Can you see it on my screen, on your screen, please?
We can see, Jyoti. You can go ahead. Yeah.
We can see your presentation.
I don't know. Okay. So, so point is that all this process, when it is happening, the alcohol is going into your blood stream, and it is straight away affecting your brain. It is affecting your cognition, your motor skills, different. People say it is a psychoactive substance, is a depressant. Why is it? Actually, people who become, loud, they become noisy, they become impaired in their judgment. They do all this stuff, which is very against. When we say it is depressant, they should basically sleep, they should relax. However, they become different. So why is it that? That is because of the blood alcohol content, which, as the number of drinks increase, the blood alcohol content also increases, and people behave differently as the blood alcohol content rises in their body. However, it is all dependent on a person to person, on age, weight, gender, how quickly is a person drinking, their physical and mental condition, the environment. A lot of things actually are responsible for making the blood alcohol content also go higher. So when we talk about these short-term effects of alcohol, the brain is under the control of alcohol, the influence of alcohol. So your entire body is under the influence of alcohol. So your GI tract is being damaged, and the basic brunt is taken care by the liver, which is the place where the alcohol is being metabolized. As it was said that people drink alcohol because of sexual desires. However, the alcohol works differently when taken in a bigger amount. So as it is clearly said over here, there are chances of sexual performance goes down, and there is a potential of miscarriage, potentials of unsafe sex. All these problems arise. Due to shortage of time, I'm just skipping few things. Long-term effects of alcohol. One of the biggest long-term effect of alcohol is alcohol dependence. It can lead to mood disorders. It can person can go into depression, anxiety. There is a lot of paranoia involved with a lot of patients which we see with alcohol disorders, and in the long run, the muscles, the muscle wasting happens, weakness, and of course cancer and GI tract problems happen in abundance. Liver cirrhosis is one of the major issues here. Alcohol can go across the placenta. So a woman who is having alcohol during the pregnancy is exposing the fetus to alcohol, and you can clearly see there are the child is formed differently and may later have memory and cognitive impairment when he grows. So basically, initial stages, we are looking at using alcohol for the euphoria and then likely to continue. So that is the initial stage. That is the positive reinforcement of alcohol for which the person had started using. But during the later stages, not using alcohol will lead to withdrawal and likely to continue or be motivated to not use alcohol. However, if there is no intervention is made in time, it can lead to abuse, and later on it can lead to alcohol dependence. So I have just mentioned the criteria here against which a person is checked. And the answer to this problem, of course, is treatment, pharmacological and psychosocial approaches. And as they say, alcohol is healthy a little bit in moderation, So I would certainly say any health benefits with regards to heart disease, quote unquote, may well be offset by the higher risks of other diseases. So be responsible, seek timely medical care. Thank you.
Thank you, Jyoti. So good clap. So even for celebration, she says it is not very good at risk. So
Thank you, sir.
Okay. Anyway, nice. I mean, good to end with very practical insights about the alcohol use from Jyoti. Thank you, Jyoti. And anybody have anything to tell her, or I will just give it to Ronnie, and we will also listen to Atiti at the end, a little bit, because
it was, sir, it was a great presentation. I was just expecting something about thalamine deficiency, but overall it was a very well presentation. Everything was.
She could give so much.
I know 7 minutes was very small. Thank you, sir. Yes, thank you for
Any
underlining.
overall comments also about all 10, 11 presenters also, you can say one or two. And then Ronnie has shared with you a small form, I think. We are just, I mean, there is no competition at all, okay? Don't get misunderstand us. We don't want to choose anybody big and small and all. But just for fun's sake, we will take only just one presenter who was best, maybe, like however you feel. So all the presenters who have presented your own presentation, you vote for yourself, no problem. Like Tiara was saying, like, no, I appreciate myself, I thank myself, great. So have that spirit also, no problem. All your presentations were good. You are free to vote for you, or you are free to vote for others also, no problem. Okay. So before giving to Ronnie, Aditi, can you give a closing remarks, like, and then we will have that exercise, small exercise at the end, okay?
Thank you, Thomas. Actually, I'm sorry, everyone. I joined only the last 3 presentations, and it was Revati's, and with the voice only, I knew it was Revati.
It was like
so. Revati actually is my senior, and she's been working in this field for donkey's years, I should say. And she, no doubt, she's given a great presentation and all the nitty-gritties of codependency. And of course, the other 2 presentations, Jyoti's, yours was very good. I know lack of shortage of time, you couldn't explain everything, but yeah, and I think the previous one, I just saw the last 3.
Pramit.
Yeah, so yeah, the one just thing that when we give, this is for psychoeducation, I guess, Thomas, right?
Psychoeducation.
Yeah, so have less on the slides, which probably Revati's slides had very less content probably, and she was explaining more. So with more examples as she gave. So I would quote again Revati for that explain something, and people like to get day-to-day examples that is very easy for them to understand. Of course, Jyoti, yours was very technical, so you couldn't have given any examples for that. But
Yes.
the rest of the topics, yes. But all of you are doing very well, as Thomas said. And I'm sure we will build up a nice team of psychoeducation here.
Thank you, Aditi. Yes.
Yeah.
So we will also have a session about psychoeducation, how creatively we can do and all. Most of you have done it so, but still we will have one more sort of a training session also before we actually hire you to be the psychoeducators. Okay.